Dry eyes, dry mouth, tired all the time. You might be dealing with more than just dehydration. Let's talk about Sjögren syndrome and what you can do about it. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Today, we're diving into a condition that does not get as much attention as it should, Sjögren syndrome. This is a chronic autoimmune condition that mostly affects women and can show up with symptoms like dry eyes, dry mouth, fatigue, and joint pain. It's often misunderstood, misdiagnosed, and sometimes missed completely. Why does it matter? Because if left untreated, it can really affect your quality of life, not just with symptoms, but also with risks of long-term complications. But here's the good news. There are smart, safe, and non-surgical ways to manage it, and that's what I'm going to walk you through today. Sjögren syndrome is an autoimmune condition. That means your immune system, which normally protects you from infections, gets confused and starts attacking your own body. In this case, it mainly targets moisture-producing glands, especially in your eyes and mouth. Imagine a garden hose that's kinked. Water can't flow through it. In Sjögren's, your tear and saliva glands are blocked by inflammation, so they don't produce enough moisture. This leads to dry, gritty eyes and a mouth that feels like cotton. But it's not just about dryness. Sjögren's can affect the joints, lungs, kidneys, nerves, and even increase the risk of lymphoma. So early recognition and treatment matters. Sjögren's affects around 1 to 4 million people in the US. It's 9 times more common in women than men and typically starts between the ages of 40 and 60. But younger adults and even children can be affected too. It can show up on its own. This is called primary Sjögren's, or along with other autoimmune diseases like rheumatoid arthritis or lupus. That's called secondary Sjögren's. Now let's go over the top symptoms. Dry eyes. You may feel like there's sand or grit in your eyes, or that your vision is blurry. Dry mouth. Eating dry food becomes hard. You may need water just to swallow. Swollen glands, especially around the jaw and neck. Fatigue. This isn't just feeling tired, it's bone-deep exhaustion. Then there's joint pain. Achy, stiff, especially in the hands and knees, developing pain. Brain fog. Trouble concentrating or remembering things, skin dryness, vaginal dryness, or chronic cough. One thing to note, everyone's experience is a bit different. Some people only have mild dryness, others have organ involvement that can be more serious. What other parts of the body can Sjögren's affect? Sjögren's isn't just about dryness, it's a whole body condition. And for many people, it can affect more than just the eyes and mouth. Let's go over the other areas it can impact so you know what to watch out for. Joints and muscles. You may feel stiffness or aching in your hands, wrists, knees, or other joints. This can feel a lot like arthritis. The good news, Sjögren's doesn't usually damage the joints in the way rheumatoid arthritis can, but it can still be frustrating and painful. The nerves can be involved, or neuropathy. Sjögren's can also affect your nerves. That might show up as tingling, numbness, or burning pain, especially in the feet or hands. Some people describe it as a pins and needles feeling. Others feel weakness or balance issues. This is called neuropathy. It can affect small nerves, large nerves, or even facial nerves. It's one of the most overlooked symptoms. Then there's your lungs. If you have a dry cough or get shortness of breath easily, it could be your lungs that are affected. Sjögren's can cause inflammation in the lungs. That's called interstitial lung disease. It can also cause airway dryness, which leads to chronic cough. Sometimes it starts quietly, so it's important to speak up if you notice these changes. Kidneys as well. Your kidneys help balance your body's pH and electrolytes. In Sjögren's, they can get inflamed too. This might show up as frequent urination, muscle cramps, or feeling more tired than usual. There's a condition called renal tubular acidosis that's linked to this, and it's treatable if caught early. Skin and blood vessels. Dry skin is common, but Sjögren's can also cause rashes or tiny purple spots called purpura. These come from inflammation in the small blood vessels a condition called vasculitis. Then there's digestive and gut health. Many people with Sjögren's have heartburn, bloating, or stomach issues. Dryness can affect the esophagus, and autoimmune inflammation can affect the stomach, liver, or pancreas in rare cases. If you're having digestive trouble that doesn't respond to usual treatments, this might be part of it. Lymph nodes and cancer risk. Sjögren's slightly increases your risk of lymphoma, a type of blood cancer. It's rare, but something to be aware of. Signs include swollen lymph nodes, weight loss, and night sweats. This is one reason why regular follow-ups is important. We can watch and catch problems early. There's also emotional and cognitive health issues. Brain fog is real. Many people feel mentally tired, forgetful, or just not as sharp. There's also a higher risk of depression and anxiety. That's not weakness, it's part of the disease, and it deserves care too. Vaginal and sexual health. Just like dry eyes and mouth, dryness can also affect the vaginal area. This can lead to discomfort, especially during intimacy. There are good treatments for this, so don't be afraid to ask for help. So yes, Sjögren's can affect nearly every part of the body, but understanding these connections helps us manage them early. If you've been noticing symptoms in different areas, even if they seem unrelated, bring them up with your doctor. They could all be part of the same bigger picture. What causes Sjögren's? We don't know the exact cause, but like many autoimmune diseases, it's likely a mix of genetics, family history of autoimmunity raises the risk, hormones, which explains why women are typically affected more often, and infections or environmental triggers. They may turn on the immune confusion. Essentially, your immune system gets tricked into thinking parts of your body are foreign and starts attacking them. Diagnosis can be tricky. Many people go years before getting the right answer, but we use a combination of the following. Symptoms, especially dry eyes, dry mouth, fatigue, and joint pain. Blood tests. Look for specific antibodies like the SSA and SSB antibodies. Also, the ANA and rheumatoid factor are frequently positive in Sjögren's patients as well. Eye tests, like the Schirmer's test to measure tear production. Lip biopsy. If needed, a small sample of lip tissue can show inflammation in the glands as well. Salivary flow or imaging can help to check how well your saliva glands are working. A rheumatologist is usually the best specialist to diagnose and treat this condition. Here's the part that matters most. How do we treat and manage Sjögren's? We use a layered approach depending on your symptoms. Step 1, treat the symptoms naturally. Eye drops such as preservative-free artificial tears can help with dry eyes. Hydration, sipping water throughout the day is essential. Chewing sugar-free gum or lozenges stimulates saliva production naturally. Using a humidifier, especially at night to keep air moist. Omega-3 supplements can help reduce inflammation and improve moisture. That's not adequate. Then we go to step 2. That's where we target the inflammation. Hydroxychloroquine or Plaquenil. This milder medication reduces the immune system overactivity. It's low risk and commonly used. Other immunomodulators, such as methotrexate or Imuran, are typically used only if joint or organ inflammation is more significant. Metabolic health. While not a cure, improving your overall immune balance through metabolic health can make a big difference. That means doing more of an anti-inflammatory diet, for example, a Mediterranean-style diet, rich in fruits and vegetables, omega-3 fats, and lean proteins. An anti-inflammatory lifestyle, getting enough sleep, reducing stress, and moving your body regularly. Exercise, walking, stretching, or resistance work can help fatigue and joint stiffness. And addressing metabolic dysfunction, insulin resistance, can worsen autoimmune issues as well. Some common myths and frequently asked questions. Is Sjögren's dry eyes and mouth? No, it's a systemic condition. Fatigue and joint pain are very real and very common, and other organs can be affected as well. Another common question, will I get worse over time? It depends. Some people stay stable for many years, others need more active treatment. Early recognition helps slow progression. Another common question, is it curable? It's not curable yet. but it is very manageable. We can even put into remission. With the right plan, you can reduce symptoms and protect your organs. And lastly, can I still live a normal life? Absolutely. With a personalized plan, many people feel better and live fully. No two patients are truly alike. My job is to help you understand what's happening, make sense of your lab results, and come up with a treatment plan that fits your goals. Shared decision-making is key. That means we work together to decide the best steps forward based on your values and preferences. Sjögren syndrome can be a frustrating and draining condition, but with the right diagnosis and treatment plan, you can manage symptoms and get back to feeling like yourself. If you or someone you know is struggling with dry eyes, dry mouth, fatigue, or joint pain, don't wait, get evaluated. You deserve answers and support. If you found this helpful, please make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and healthy. You can also schedule a consultation directly with our office. See you next time, and as always, live well.